Good evening, everyone. I'm Stephanie Coleman. I'm with Kansas Lend. I'm the Autism Family Educator here at the University of Kansas Medical Center at Kansas Lend. I'm really excited for our session this evening, Nurturing Couple Relationships in Families with Special Needs with Dr. Stephen Lassen. He is a colleague in Division of Developmental and Behavioral Pediatrics at KU. Before we get started, for those of you who have joined us before, thank you. We're happy to have you back again. For those of you who are here for the first time, welcome. With it being a nice cold Kansas evening, it's a great time to sit on an hour webinar and listen to some great information. So we're really happy to have you here. If you don't know Lend is Leadership Education and Neurodevelopmental and Related Disabilities. It is a workforce training grant that KU has, and we work together with several different disciplines to support individuals with disabilities. So we train graduate level students on autism and related disabilities and how best to support them in a team environment. So with that said, I am going to turn it over to Dr. Lassen. If you have questions, feel free to put them in the chat. We will get them answered at the end. Thanks, everyone.
Well, good evening, everyone. It's really nice to be with you. And I appreciate you taking the time to do this on a kind of a later, dark, cold night. And hopefully you're comfortable wherever you are. There's no heat on our floor at the moment, so I hope you're more comfortable than I am. We'll put it that way. But it's really good to be here. I really appreciate Stephanie's insight in identifying this as a topic that needs some attention. I don't think I've ever been able to talk to a group about this before, but over the 17 and a half years I've been here at KU, this is kind of what I experience day in and day out with families who have children with special needs of various kinds. And it's always such a privilege to partner with them and to learn from them. And so hopefully I can share some of what I've learned about that with you tonight. I'm not sure who all we have represented here, but I've tried to include information that would be of value and interesting to a variety of folks in different situations. So yeah, I look forward to a conversation. We'll try to leave 5 or 10 minutes at the end to discuss and have some conversation. So when we talk about families who have children with special needs, I think that really takes in a lot of different situations. And for our purposes here tonight, I want to talk about special needs as anything from learning problems to behavioral and emotional disorders, developmental disabilities to chronic health conditions. Really any exceptionality that a child has that requires something different than most other children would require. So I think as we broaden the scope to that degree, we see that there are a lot of families that fall into this category. And we'll be trying to focus really on couple relationships tonight. We could probably have another discussion like this just focused on siblings, because siblings are oftentimes caught in the crosshairs of these dynamics and challenges. So in our house, we like Calvin and Hobbes. We have all of these books, and I think Calvin is a great example of a lot of what we can struggle with in families. See up here, Calvin screaming and his parents obviously distressed. And at the bottom, his mom says, "Another parent-teacher conference." And his dad says, "It's your turn." So Calvin is certainly a child with some special needs, and you can see the impact of all of that on his parents' faces, their bodies. So what's a day in the life of a parent, a couple with a child who have a child with a disability? What does that look like? Well, there can be behavioral, emotional challenges, emotional outbursts, anger outbursts in public, destruction of property at home. There can be healthcare, mental health care appointments and procedures to navigate. There's certainly a financial burden for many families who have to pay for medications and hospitalizations and procedures and appointments. There's coordinating all of this day in and day out, which can be exhausting for parents who are also trying to work and do other things. Coordinating and managing medications, interfacing with healthcare providers, with school staff, with other ancillary staff who are involved in a child's life. So doing all of this day in and day out is certainly an exhausting task for a couple. Sometimes when I talk with couples who are in similar situations, I talk with them about it like they have a backpack full of rocks that they're carrying around with them. And, at first the backpack is manageable. At first, I feel like you can carry it just fine. But over time, what happens is that we start to fatigue, it starts to feel heavier, starts to become emotionally draining at some point as well. So there's an unpredictability, there's a chronicity to all of this that can be really difficult for couples to navigate and can contribute to an imbalance in the relationship that can be detrimental to them. And just as an example, I just got this recent email from a mother who has a 7-year-old with Loeys-Dietz syndrome, which is a genetic syndrome that has effects on lots of different systems in the body, musculoskeletal and cardiac, and all sorts of challenges, as well as neurocognitive. Anyway, just get a sense of just what life must be like for some of these families. She said, "It's been rough, scared every time someone checks him. The orthopedics team came in to fit him for a brace and he screamed and cried the entire time. He was just measuring him, but needed oxygen because he held his breath from crying. He's been retching blood since he woke up. The CNA took his blood pressure cuff off his leg earlier, came in and turned it on, and he started crying, said his leg hurt, but it was off his leg since the CNA took it off. He cries in his sleep and started suckling like he has a pacifier. He doesn't want me to leave the room. It's been rough." So this is just one very, very small snippet from this couple's life as they are parenting this child who has very, very significant needs. I just noticed
Your screen is going back and forth. You may just want to turn your camera off.
Okay.
That way it's not distracting for us or you.
Is that distracting for you?
It can be a little bit distracting. There we go.
Sorry about that. So what are some of the challenges that couples face when they have a child with a disability? Now, I want to emphasize to begin with that these aren't all necessarily problems, but these are situations and realities about raising a child with a disability. Just because they exist doesn't mean they necessarily will create a problem in the relationship, but they can certainly put additional strain on it. So what are some of those challenges that couples face? They certainly report a lot of loss of intimacy with each other, just not as much time together to talk and to be together because of the demands of the child. They report less free time, not only as a couple, but also individually. They're less likely to be engaged in hobbies and fun activities on their own. There's oftentimes a lot of guilt about a child's disability. I see this a lot in the families in our NICU that I work with who have very premature and critically ill babies in the hospital. And many parents feel a great amount of guilt that they have somehow passed this on or did something during pregnancy to cause this disability. In couples, we frequently see different opinions about a child's disability. I deal with this very, very frequently with families where one parent is interpreting things and seeing things from one perspective, and the other parent has seen it from a very different perspective. Parents may experience it, you know, in terms of stress in different ways, and they may have very different opinions about how to proceed with treatment and management. And then if there are other children in the home, there's typically less attention given to those other children, which can be stressful for the children, but also stressful for the couple, as they are wanting to give more time to them, but just don't feel like they can. So again, none of these necessarily mean that there will be dysfunction or problems in the relationship, but there's a likelihood that will happen. And we'll talk more about some of the recent and updated data in this area. So historically speaking, these kinds of situations where there was a child with a disability was seen as a family tragedy. And that these situations were really only seen in terms of the stress and pathology that they created. Parental relationships were historically portrayed as difficult, dysfunctional, likely to end in divorce. This was a telling statement from a physician just from the mid-90s, so just 25 years or so ago. Said if you have one brain damaged baby, the human toll that takes for the rest of the family, you just can't estimate. There's upwards of a 90% divorce rate if there's a damaged baby in the house. Now, it's just a horrible statement in so many ways and at so many levels. But this wasn't that long ago that a medical professional was expressing this view. Now, unfortunately, there continues to be this perception, especially in popular media, that couple relationships are just doomed to divorce and separation, dysfunction when they have a child with a disability. And I will say that most the research and media attention seems to be focused on children with autism and developmental disabilities. So we're still not out of the woods in terms of some of these assumptions and stereotypes. But I hope we're making progress and moving forward. So I'm sure a lot of this sounds familiar. You know, if you read popular news stories, you'll get a sense of this, that these situations just create a lot of dysfunction in family relationships. Well, as we look at the actual research on how child disability affects couple relationships, what do we find? Well, it's a large research, it's a large area to try to understand. And so there's a lot of complexity to it, but I wanted to really kind of summarize the literature in just two words. And the first word is vulnerability. So we do see that there are some couples whose relationships do seem to suffer because of having a child with a disability. Now, why that is really more nuanced. It's not because of the child necessarily. And we'll get into more of that as we move along, but the child doesn't cause the dysfunction, but some of the pre-existing risk factors and some of the ways that couples can manage these kinds of situations can lead to that. So the first summary word is vulnerability, but the second word that I would use to kind of summarize this area would be variability. There is a lot of variability in the research findings in this area. It really is mixed. So this first slide here it shows that there are research findings that indicate that that there are lower levels of marital adjustment for some, satisfaction and happiness, and there are higher levels of separation and divorce in some couples, and that especially with the birth of a child with autism, that the perceptions of couples connectedness, closeness, and attachment can begin to decline pretty soon after the birth of a child. So that certainly exists in the literature. There are some studies that show that demonstrate that. However, there are also an equal number of research studies that show more positive adaptation to having a child with a disability. There are increased positive emotions. There are higher levels of resilience that couples report. There are strengthened couple bonds with each other. And a really interesting, more recent finding is high levels of post-traumatic growth that couples report. Now, post-traumatic growth is a relatively new field in the last 20 or 30 years. And it's this idea that we can experience personal enhancement in our well-being as a result of a traumatic event that happens in our lives. And we see it actually broadly over a lot of different areas and subgroups. But there's a few studies starting to come out in looking at couples who have a child with a disability. So these couples are reporting things like better couple relationships and a better sense of what's important in my life, positive growth in belief systems and values. So there's all these areas of growth that couples are reporting. And so I think that's certainly important to show in the literature that we see really both sides of this. Now, I wanted to highlight one study in particular from 2001, and I wanted to highlight it because I think methodologically it's far and above, better than most of the studies in this area. And it's better because it's a prospective study, which means that we're looking forward and we're measuring things as they develop naturally, as opposed to retrospective studies, which tend to ask people to self-report on what's happened in the past. So it's prospective, but it's also a longitudinal design, which means that it will tend to capture patterns better than just a cross-sectional design will. So in a lot of ways, this may have a greater impact in the literature than most of these other studies, just because of the design. So there's 7,000 18-year-olds in Wisconsin that were enrolled in this study, and they are going to be followed until they're 54 years of age. So they're going to be followed for a long time. But keep in mind that when they started the study, none of these individuals had children. They were all single, and none of them had children. So as the study has gone along and progressed, these are some of the findings that they've reported on. That parents who had children with disabilities had lower rates of employment, they had larger families on average, and they had lower rates of social participation. I'm not sure why they're finding lower rates of employment or even larger families. I will say that the lower rates of social participation make sense, given what we know about the time that's required to parent kids with disabilities. There can often be this sense of, I just don't have time to go out and socialize. When I do have time, all I want to do is go to sleep, go to bed. So that was one finding. The second set of findings were that there weren't any differences in levels of education, marital status, physical health, and psychological well-being. So we can put a little bit more stock in these findings because of the methodology. And I think it's an interesting set of findings. And I think it does tend to reinforce this idea that families are probably doing a whole lot better than we have been made to believe that they are. So the findings are really mixed. They're nuanced. They're complicated. We still don't have a real clear picture, but the best studies that we have seem to support this idea that families are doing better and that as couples, relationships may be healthier than we thought. So when we think about who might be at risk for relationship stress, because there certainly are those couples who experience a lot of relationship stress, who's at risk? Parents who have very heavy daily demands for childcare tend to have more stress in the relationship. Now, this is really independent of children with disability. Any parent who has a heavy daily demand for childcare is going to be at relative risk for some relationship stress. Mothers are particularly vulnerable in this area because they tend to have more direct involvement with kids. Another risk factor is an unequal distribution of childcare tasks. So some overlap with that first one, but we do find that where childcare is unequal or not distributed very evenly, that there is more risk. When there's lack of time for leisure activities, there's certainly more risk for relationship stress. And that goes back to this idea that where there's imbalance, there's more risk. If one or both parents have mental health symptoms, either actively or historically, or even where there's genetic predisposition for mental health symptoms, that can also convey additional risk. Poor family support, social isolation, low child psychosocial quality of life, and then young couples, especially who are early in their relationship, are more prone to relationship stress. So I will add one to that, I think, before we move on, and that is where there is pre-existing relationship distress. Having a child with a disability usually doesn't do anything to help pre-existing distress that a couple might have. And so that's really important to keep in mind, that how the couple comes to the situation of having a child with a disability or special needs matters. Now, alternatively, what tends to protect a couple from stress? Well, those who have a strong supportive relationship with each other certainly tend to do better. Those who have professional and personal supports, family and friends, colleagues, but also those who have engaged with professional counselors, therapists, psychologists, tend to do better. And that's probably because they also tend to have more effective coping strategies. It's not so much about what the child's needs are as much as how able and effective the couple is at coping with those things. And then having a positive mindset, and we'll talk more about that as we move along, but the mindset with which a couple approaches parenting a child with a disability is maybe one of the most important things that they can focus on and try to do right. So this is the family stress theory, which was developed in 1949 by a sociologist by the name of Reuben Hill. And he initially designed it to describe wartime separation and reunion of families. That separation being the stressor event, and the reunion being the resolution of the crisis or the outcome. But this theory really focuses on three factors that shape how a family or a couple handles stress. First of all, there's the stressor event itself and what the nature of that stressor event, if it's a single event, if it's a chronic situation. The second would be the resources and strengths of the couple, and to what degree do they can they cope successfully with stress. What supports do they have around them? And then the third factor is the couple's perception of the event. So again, the event itself isn't as important as these other two factors, the perception that the couple has of what's happening and the resources that they come to the event with. Both of those affect how the couple experiences all of this, and then ultimately will determine the outcome of the event. And so to the extent that a couple has a positive and accurate perception of what's going on, to the extent they have well-developed resources, they're going to tend to adapt better to that stressor. So we talk about this in terms of 3 phases, where there's some initial disorganization following the emergence of the stressor. And with a couple who have a child with a disability, this can be kind of this mindset of disbelief of I can't imagine, I can't believe what's happening. I didn't expect this, and what's all of this mean for our family, and how are we going to manage it, and all of those initial reactions that couples have. As time moves on, that moves to the next phase of recovery, where there starts to be some adaptation, some ability to manage day to day. And then ultimately, there's reorganization of the system, of the couple system and the family system, so that they are able to manage effectively and efficiently day to day. So I think this is a helpful theory to use for couples, even though it wasn't designed for that. I think it has a lot in common with what couples experience. Okay, so are all child exceptionalities created equal? We talk about children with special needs like it's one big group, but it's really not. As we think about the different nuances of child exceptionalities and disabilities, we see that they vary across a lot of different factors. These are just 4 of those factors. But child disability varies in terms of disability type, whether it's a very physical disability like cerebral palsy, or emotional and behavioral, and certainly what the public perceptions are of the disability. For example, there's been something in the literature called the Down syndrome advantage. If any of you have heard of that before, but it's this idea that we have certain assumptions about children and individuals with Down syndrome that cause us to approach them in more favorable ways. We tend to have more positive feelings about them. And so that public perception really matters in terms of the impact of that exceptionality. Whereas public perceptions of perhaps a child with a very intense behavioral or emotional disability might be very different. They look perfectly normal, but maybe they're having a tantrum at Walmart, and they're throwing things around, and there can be more negative perceptions and assumptions about that from the public. So the disability type matters. They're not all created equal. Some are just more difficult to manage day to day than others are. The severity of the disability matters. So not only the disability type, but how severe that is, which is a separate spectrum for each of these individual disabilities. Down syndrome has a spectrum of severity. Autism has a severity spectrum. So all of these things can be more or less severe and can affect how much it impacts a couple. The impact on day-to-day activities, the complexity of treatment efforts. I'm working with a family who they have a little boy who has a very complicated genetic syndrome, and they have to go to Johns Hopkins Medical Center several times a year to get very specialized treatments for him there. They have to stay a week at a time. It disrupts jobs and it disrupts the lives of the other siblings. And so in his case, the severity of his disability is quite high and requires a lot of day-to-day management by this couple. The family dynamics that surround the disability matters too, whether or not they're siblings, what the parental relationship is like to begin with. All of those matter. And then the timing of diagnosis matters too. Generally in the literature, it is suggested that diagnoses that are made early in life are less impactful, or that couples are more successful at managing than those that come later in life. And the thought is that when you have time to prepare yourself, to educate yourself, to gather a team around you when a child is very young, perhaps even in utero, some of these things are diagnosed, then that is relatively easier than starting life, having several years where things are okay, and then having a disability that emerge later can be. Okay, we're going to shift a little bit now to talk about some practical ideas about how to just support couples who are in these situations, or if any of you are in these situations yourselves, what you can do to really manage the stress of all this in an effective way. So I like to think about this in terms of a plant or a tree. I don't think anyone would argue that a plant needs to be fed. No one would expect a plant to survive without adequate food and water. But somehow, sometimes we expect ourselves to thrive without nourishment. So what do we need as we think about feeding our own plant? What do we need in terms of nourishment? So relationships not only need their own nourishment, but they really thrive when both partners are well nourished individually, and there's balance and there's equality in terms of that. So what do we do to feed our own plant? Well, these things should look familiar. They may be things that you even tell other people to do, but maybe don't do very well yourself. We need to schedule regular time to do things that we love to do. That seems pretty simple, but I see a lot of couples and individual parents who aren't really doing anything that they enjoy doing. They're just going from task to task. Then they sleep for a little while. They get up and rinse and repeat the whole process again. When we are doing things that we love, it changes our brain chemistry. So it increases things like dopamine, it increases serotonin, and those neurochemicals that we know enhance our mood and help us to cope better with life. So we really need to schedule regular time, and the emphasis here is on regular. You can't do this once a year and just be done with it. But it's like brushing your teeth every day. The benefit of brushing your teeth is doing it every day. It's not doing it once in a while. So the power is really in the consistency of doing this and really allowing yourself the time to do it. And we'll talk more about some ideas about how to do that later on. Continuing to educate yourself about your child's diagnosis, so very, very helpful. What we do when we educate ourselves is we reduce uncertainty in our lives. And whenever we reduce uncertainty in life, we feel better and we have less anxiety and we function better. And so continuing to educate yourself about that diagnosis is something that's really a lifelong task, but something that can really help nourish yourself to feel more empowered, really, to parent your child. The couples need to individually reach out to people who love and support them. Everything in life seems to get better when we have supportive people around us. So everything seems to be positively correlated with social support. So allow people to help, share with them what you need, and give them jobs to do to help support you. Sleep, I hope that goes without saying. For those of you who are Shakespeare fans, Shakespeare memorably referred to sleep as nature's soft nurse. And I love that phrase, that sleep is so vital to our overall well-being, to our immune support and function, to how we process difficult situations. Nutrition, how we feed our body, very literally like a plant, has everything to do with how we feel and how we're able to take on stressful things that come up in life. And then physical activity also. Maybe nothing is as important as regular physical activity to help us function well. So those are just some ideas for how we can feed that plant individually, all kind of with the idea of strengthening the couple relationship. So if you're working with families in these situations, couples, that those are good ideas to pass on to them. Now, there's also the plant of the relationship that needs to be fed. And so let's go over some ideas for how to feed that particular plant.
Be a team. Don't put the burden all on one parent.
Be a team. Don't put all the burden on one parent. Sometimes this happens. Sometimes it's because one of the parents is in healthcare, or one of the parents just knows more about it or is more motivated to learn more about it. But when there's imbalance in that burden sharing, then that places more stress on the relationship. So the couple really needs to approach this as a team effort. Secondly, appreciate and support parenting differences. Every parent is different. Every parent is going to think about things differently, and that can be a really lovely, powerful thing to have different perspectives. So appreciate that and nurture that and support those parenting differences. Managing the expectations of each other is really important. Each partner will have different expectations of the other person, and to have those communicated honestly and directly is really helpful. Being able to prioritize the relationship, spending quality time together that's regular time is so therapeutic and very healing. And then soliciting and accepting help from loved ones. There's a story that's shared by Samuel Whitman. I don't know if anyone has ever read this, but it's called Forgotten Wedges. And he tells the story of this very large, beautiful walnut tree that was destroyed in an ice storm one day. And it just split down the middle and completely fell apart. And the owner of the property came out the next day to look at the damage, at what had happened to this tree, and noticed that lying there on the ground was a large iron wedge. And years before, that same man, who had been a boy at the time, had been out working with some trees and had placed that iron wedge in this young walnut tree, and had intended to take it out when he was ready to go back inside, but forgot about the wedge. And that wedge stayed there on that young walnut tree. And over time, the tree began to grow around it. And until ultimately, the wedge was completely invisible. It was completely buried within the tree. the tree had grown around it. And then the night of that ice storm came, and because of that wedge that was inside the tree, it completely destroyed the tree. So I guess the correlation there, you may be wondering, what on earth does that have to do with anything? Well, in relationships, when there's a weakness in the relationship, then the couple is more susceptible to the stress or the storm of parenting a child with a disability and having it damage the relationship. And so it's so vital that weaknesses within the relationship are dealt with very proactively and very directly, so that there isn't anything that would weaken the tree, would weaken the relationship, and cause problems later on. So helping couples identify any pre-existing weaknesses and addressing those can be really important. So much of the work that has to be done by a couple who has a child with a disability is learning to adjust to new expectations and managing unmet expectations. I don't think I've ever talked with a couple who expected to have a child with a disability. That's not on your radar as you think about having children, as you think about starting a family. It just isn't there. And so what happens is when it comes about in life for a couple, then that represents an unmet expectation. And I think it's really important for couples to acknowledge that and have a process where they can acclimate and adjust to those new expectations. So first of all, it's important for the couple to be able to identify and validate the loss, to name it, and to be able to start to embrace what's happened is really an important first step. Allowing space for grieving. Whenever there's a loss in our lives, we grieve that loss. Sometimes we think about loss only when there's a death, which is a particular kind of loss, but there are so many other losses that couples who have children with disabilities experience. They experience loss of dreams for the child, loss of hopes that they had, loss of financial freedom, loss of personal freedom, loss of the ability to just go out with friends and whenever they want to on the weekend. I remember we had a mom years ago who had a child when she was very young. I think she was even 14 or 15 when she had this baby boy, but he ended up having cystic fibrosis. And I remember for years, she would come and drop off her baby at the emergency room on Friday night so she could go out and have fun with her friends for the weekend. And that was her way of, in a very adolescent kind of manner, to deal with this loss of I need to go out with my friends, and this is the only way I can think of for how to make that work. So there needs to be space for grieving. We need to help couples embrace their current circumstances. Whenever we fight against things in our lives, it tends to get worse. If we fight against what's happening in our lives, it doesn't help us at all, but we need to embrace those circumstances and then really create a new set of circumstances, a new set of expectations. I can see we are coming down to time, so let me kind of breeze through these last few slides. Acceptance and commitment therapy, I think it's a really cool intervention that has been recently introduced in the psychological treatment field area. It really has to do with psychological flexibility, being able to think about situations more flexibly, acknowledging what's happening, being able to allow for that in our lives, being able to accommodate it and adjust to it, and then ultimately appreciating the benefit that has in our lives. There are a lot of couples who, with some prompting and some coaching, and even some who don't get that, but they're able to see the benefit that child and the situation has in their lives, and they become very, very grateful for it. There's a lot of value and a lot of wonderful things that happen when we have a child with a disability. I like to use this metaphor of having like an annoying uncle come to the door. It's kind of like that when you have something unique in life that happens to you. It's like having this person come to the door that you really didn't want to come to the door, but you have to deal with him now that he's at the doorstep, and acknowledging that he's there, allowing him to come in, accommodating him in some way, and then appreciating what he can offer to you in your life. So hopefully there's some principles there that can help. Now let me move on. I wanted to do some Q&A and include some questions that I have gotten from couples over and over and over again over the years, in hopes that they might be beneficial for some of you. Okay, so first question: I don't have time for anything extra in my life. How can I fit any of this into my schedule? Well, that's a reasonable question and concern. I guess part of the answer, at least my answer, would be to really start to think of self-care as not just something that you need to fit into your life, like you're trying to fit an apple into your backpack or your lunchbox, but it's really a basic human requirement. And it doesn't mean that it has to consume your life, but it does mean that it has to have a space in your life. And so as long as we just think of self-care as another thing that we have to do, it will be very difficult to incorporate it into our lives. So there may need to be some shuffling around of things, but start to see self-care as really a basic human requirement. Question number 2, isn't it selfish to take time away from my child for myself and or my partner? I hear this all the time in the NICU. I have these moms and dads who will not leave the bedside. They don't shower, they don't eat, they don't sleep very much because they think it's selfish to be away from their child because they're the parent and they gotta do all of this. Well, my answer to this partially is that we know that children's well-being is absolutely related to parental well-being. Those two things are inextricably linked. How parents do influences how children do. And so seen from that perspective, I think self-care is really a selfless gift that we can give our children. Because when we're taking care of ourselves, we're in better shape to take care of them. And we're also modeling something really important for our kids. Question number 3, I don't feel like I have a life of my own. How do I start to change that? And that's, again, something that a lot of parents feel. They feel like they're just parents and they're just machines that are parenting their kids. So some parents really need to work on finding themselves again, reconnecting with interests and skills and talents that they have, and then finding some time to dedicate to these activities. If we had more time, I'd tell you about Peter Vidmar, who is an Olympic gymnast champion, gold medalist at the 1984 Los Angeles Olympics. But his secret to success was devoting 10 extra minutes in the gym after everyone had left. That's all he did, 10 minutes after everybody left. And over time, what happens is that is cumulative and that adds up in our lives. So again, this stuff doesn't need to be hours every day, but I think we've all got 10 minutes. We can all devote 10 minutes to taking care of ourselves. Question number, what are we on 4? My partner and I are grown adults. We can handle focusing on our child. He or she needs us more than we need time for ourselves. What's the big deal? So this is the Superman and Superwoman syndrome. Thinking you can do it all on your own, expecting yourselves to do it all on your own. Well, we can't give what we don't have. This inevitably leads to burnout and unbalanced parents. And we know that when we're burned out and unbalanced, we're just not as effective. We're not as attentive to children. We're not as emotionally available. So again, what we want to do is model a balanced lifestyle for our kids. So that's another gift that we can give them. And then lastly, for tonight, seems like my relationship with my partner is defined by our child's needs. How do we fit our needs into an already busy schedule? Well, we've talked a little bit about this already, but focus on giving yourselves space. That space might be small at first. It may be only 10 minutes a day or 10 minutes a week, but prioritizing that is a way to start. Now, I will say that sometimes we need to reevaluate where we spend our time, and we may need to simplify in other areas of life. One of the things I typically ask parents to do is to go home and record how much time they spend in different activities in life. How much time do you spend fixing meals? How much time do you spend cleaning? How much time do you spend on your phone? And a lot of parents will come back and say something like, I had no idea I was spending so much time on my phone just scrolling. I think I can recoup some time from that and give myself 10 minutes to do something that really fulfills me and not something that's just passive, like scrolling through social media. So those are some things, some ideas for how to address those questions. For those of you who support families with children who have special needs, some other ideas to help parents, to support parents in this journey. I think one of the things we neglect a lot of times are how parents are doing. And so checking in with parents about how they're doing is really important in all that we do. And then just some resources. I'm sure Stephanie has better ones than this, but these were some that came to mind. Some of these first three are organizations that do a lot of good work and a lot of support for families who have children with disabilities. Ability KC is a great collection of services and interventions here locally. There's podcasts, there's books, there's apps, there's all sorts of different things, different ways to get support and continue to educate ourselves. So take advantage of those. And maybe that's where you spend your 10 minutes a day. You listen to a little bit of a podcast or you read a few pages of a book. Okay, we are going to end there. And I would love to hear questions that you have, comments, impressions as we've chatted.
Feel free to either write the question in or take yourself off mute and ask any questions you may have. I do know that, I think about it, and when you're taking care of yourself and you have a clear mind, you're going to be better prepared to handle your child in an effective manner versus in a manner that you just, because you're so stressed out, I can't think of the word I'm thinking of, but all that does later when you lash out at your child because you haven't been taking care of yourself and you lash out at that child, all that's going to do is provide more guilt and stress on you.
Yeah.
So take that 10 minutes a day. We all have 10 minutes.
Yeah.
I'm a single parent and I've been able to find, and I've learned the hard way, when you don't take care of yourself, your body's gonna tell you, well, we're done. We're gonna make you start taking care of yourself. So
Yeah, and I think in many ways it's a mindset of prevention, and we don't do that very well. We tend to react to things that happen in front of us, but we don't prevent. And we do that as a society, right? We put up stop signs after there's accidents. We don't put
yeah,
up stop signs until there's a problem or a traffic light. So yeah, I think approaching it from a prevention standpoint and not just when you kind of fall apart and have to address it is really wise.
Mind you, it took me a long time to learn that one too.
Yeah, well, you learned it. That's
Yes, I did.
that's the important part.
Anybody have any questions, comments, thoughts?
I have a question about
Sure.
the presentation itself.
Okay.
Would you send us a link for the presentation afterwards?
Yeah, so by Monday afternoon, this will be uploaded to YouTube
Okay.
and you'll be able to access that from there.
Would you be okay if we share it with other families?
Absolutely. No, this information is out there. We want you to share this information with other families. The more families that know this, the better our society will be in our community
Okay.
in supporting
Okay. Thank
each
you. I
other.
appreciate that.
You're
Yes.
welcome. Any other questions? Okay.
Quiet group.
Well, you did an amazing job, obviously. So that's fantastic. Or they're all just too cold.
Frozen.
Too cold
Well,
to come off mute and ask the questions. So
I hope there was something in there for everybody to kind of reflect on. I think whether we're in the middle of parenting a child with a disability, whether we're supporting a couple who has a child with a disability, or are involved professionally with families in these situations. I think in some way it touches all of us. And so I hope that there are some helpful tips or ideas in all of this that will help you in whatever phase of life and whatever situation you find yourself in. But again, I really want to emphasize that, you know, parenting a child with a disability is an opportunity. It does present a lot of unique challenges, but those challenges don't have to become problematic in our lives. They don't have to become problematic in relationships, but it's all about how we choose to approach those that seems to matter. And so as we do that with enthusiasm and curiosity and energy, things will tend to go a lot better. So anyway, I'm available if anyone, you know, has a question later on. Happy to chat more offline too. So
yeah, and feel free to reach out to me and I can get you connected with Dr. Lassen if you have any questions later. But I want to thank Dr. Lassen for joining us this evening from his cold office. I actually stayed home because I knew it was cold in those offices. So I appreciate him joining us tonight and sharing this information. I appreciate you all joining us this evening and learning more information and wanting to share it with others. Together we can help more individuals and create more advocates for our kiddos that need that. So thank you for that. There'll be information coming out in the next week or two about our February session, which will be on the passports, a health passport and a dental passport. If you haven't heard about those, there'll be that information. And then I know Dr. Lassen mentioned siblings, a session on siblings. We will actually have a sibling session in September. So feel free to watch my emails for that information too. But everybody, I don't know where you are. Stay warm, stay safe, and thanks for joining us tonight. Have a good evening.